Everyone, Piscean here. In this video, we're going to look at this medical astrology compendium with the help of Report Labs. I was able to get this crafted, and we're going to go over principles, correspondences, case studies, as well as visuals. An illustrated educational reference on the historical and traditional associations of the zodiac, planets, and houses with the human body and health. And a real quick disclaimer here. This document is an educational and historical overview of traditional medical astrology. It is not medical advice, diagnosis, or treatment. Always consult qualified healthcare professionals for any healthcare concerns. Astrology is a symbolic system without scientific validation as a diagnostic tool. So, excuse me, this table of contents we're going to look at in this video. We're going to begin with the introduction and historical context. Look at the zodiac man, signs and body regions, planetary rulerships of organs and functions, the 12 houses in medical astrology, humors, temperaments, and elemental qualities, practical examples and interpretive framework, illustrated case studies, timing considerations, transits decompositure, glossary of key terms, as well as selected footnotes and further reading. So page number in the printed edition corresponds with running footer. In this video, we're going to look at the intro first. Medical astrology, traditionally called iatromathematics, is a historical practice of correlating celestial bodies, the sun, moon, planets, and the 12 zodiac signs with parts of the human body, physiological processes, diseases, and therapeutic timing. So its roots reach into Mesopotamian Roman literature, Hellenistic Greek medicine, Indian geotist traditions, and medieval European and Arabic scholarship. And we see that the central organizing image is a zodiac man, or Homo signorum, a diagram that maps the 12 signs onto the body, from head Aries to the feet Pisces. Physicians from the Middle Ages through the early modern period consulted the position of the moon in the zodiac before performing bloodletting, surgery, or administering remedies, believing that operating on a body part while the moon occupied its ruling sign risked excessive bleeding or complications. Hippocrates is often quoted, perhaps apocryphally, as seeing that a physician without knowledge of astrology had no right to call himself a physician. Galen integrated planetary and humoral theory. Ptolemy's tetrabiblos provided a theoretical framework, and Renaissance figures such as Nicholas Culpeper linked planetary rulerships to herbal medicine. By the late 17th century, the practice declined in official medicine, yet it persisted in folk and esoteric traditions, and is in modern revival as a symbolic and historical study. And this compendium presents the classical correspondences, interpretive methods, and illustrative case studies purely for educational purposes. It does not claim predictive or diagnostic validity in the modern scientific sense. So, in Wikipedia entry, medical astrology, historical surveys of iatromathematics, term derives from Greek iatros, physician, and mathematics in the classical sense of calculating celestial positions. The zodiac man appears in numerous medieval manuscripts, almanacs, and books of hours. The lunar prohibition on operating on a moon sign is documented in surgical manuals of the period. Alright, so we see the zodiac man, signs and body regions. So Melethesia is a doctrine that each zodiac sign governs a specific region of the body. The sequence runs from the head, again Aries, to the feet, Pisces, reflecting the natural order of the zodiac. When a malefic planet occupies or aspects a sign, traditional practice regarded the corresponding body part as vulnerable. Benefics were thought to protect or strengthen it. And we see this is a schematic of the zodiac well with traditional body region correspondences, educational diagram, not a clinical map. So you see, beginning with Aries, the head, you get Taurus, the throat, Gemini, arms, lungs, Cancer, chest, Leo is the heart, Virgo is the intestines, Libra is the kidneys, Scorpio is the pelvis, Sagittarius the hips, Capricorn is the knees, Aquarius the ankles, Pisces the feet. And detailed correspondences here, so we see the sign as well as primary body regions and associated tendencies traditionally. So Aries is fire, head, face, brain, eyes, adrenal glands, headaches, migraines, sinus issues, head injuries, high fever. Taurus, earth, throat, neck, thyroid, vocal cords, lower jaw. Sore throat, thyroid imbalance, neck tension, and voice strain. Gemini, air, arms, shoulders, hands, lungs, nervous system. Respiratory complaints, nervous restlessness, shoulder, arm injuries. Cancer, water, chest, breast, stomach, upper digestive tract. Digestive sensitivity, stomach acidity, fluid retention, emotional eating. Leo, fire, heart, spine, upper back circulation, heart strain, spinal tension, pride-related stress responses. Virgo, earth, intestines, digestive organs, spleen, assimilation, digestive disorders, food sensitivities, worry-related symptoms. Libra, air, kidneys, lower back, lumbar region, skin balance, kidney stress, lower back pain, skin conditions, acid-base issues. Scorpio, water, reproductive organs, bladder, colon, elimination, reproduction, reproductive or urinary concerns, detoxification themes. Sagittarius, fire, hips, thighs, liver, sciatic nerve, hips, thighs, strain, liver overload, sciatica, excess. Capricorn, earth, knees, bones, joints, teeth, skeletal structure, joint stiffness, bone density concerns, chronic structural issues. Aquarius, air, ankles, calves, circulation, lower legs, and circulatory irregularities, ankle weakness, and nervous tension. Pisces, water, feet, toes, lymphatic system, immune response, foot problems, lymphatic sluggishness, boundary immune themes. So classical, melothesia, zodiac signs, and body regions with commonly cited traditional susceptibilities. Correspondences are remarkably consistent across Hellenistic, medieval European, and Vedic sources, with only minor local variations, for example, exact assignment of the internal organs. Planetary rulerships of organs and functions. So while signs indicate where in the body an influence may be expressed, planets are going to indicate the how. Quality of the energy, type of process, and style of manifestation. A planet in a sign activates that body region with its characteristic nature. And we see here the planet, primary organs, systems, qualities, and traditional associations. So for example, the sun, heart, spine, vital force, red eye, traditional overall constitution. Hot, dry, vitality, inflammation when afflicted, life force, and recovery capacity. So again, these are planetary physiological correspondences. Outer planets are modern additions. In classical practice, uses 7 traditional planets: Sun through Saturn, Moon. Moon's going to be stomach, breast, bodily fluids, lymphatic system, left eye, mind, mood, cold and moist, rhythms, fertility, fluid balance, emotional, mental state. Mercury, nervous systems, lungs, hands, speech organs, coordination. Variable, often cold and dry, communication, nerves, respiratory function. Venus, kidneys, veins, skin, throat, hormonal balance, reproductive harmony. Hot and moist, benefic, harmony, skin, urinary, and venous systems. Mars, muscles, blood, arterial, bile, male generative organs, inflammation. Hot and dry, heat, fever, injury, surgery, acute inflammatory processes. Jupiter, liver, growth, arterial blood, fats, expansion, immune abundance. Hot and moist, benefic, growth, excess, metabolic expansion, and production. Saturn, bones, teeth, joints, skin as boundary, spleen, chronic structures. Cold and dry, restriction, chronicity, hardening, longevity, decay. Uranus, nervous system, sudden circulation anomalies, breakthroughs. Erratic sudden events, electrical nervous shocks, unconventional patterns. Neptune, pituitary, pineal, immune subtlety, dissolution, toxicity themes. Diffusive confusion, sensitivity, infection, vulnerability, idealism. In Pluto, deep regeneration, cellular processes, eliminative organs, transformation. Intense crises, purge, rebirth, hidden or deep-seated processes. So, in practice, an afflicted Mars and Aries might be read as inflammatory or injury-prone conditions affecting the head, and will aspect of Jupiter and Sagittarius as robust hepatic function and resilience in the hips, thighs region. So the combination of planet and sign and house and aspects yields the full traditional the picture. So classical sources, Ptolemy, Lilly, Culpeper, and Vedic texts show high agreement on the core 7 planets. Modern outer planet associations are more variable among the practitioners. 12 houses in medical astrology. So houses add a further layer to show the life context in which health themes appear. So we see that the first house, the ascendant, represents the body and overall vitality. The 6th is the classic house of illness, daily routines and service. The 8th relates to chronic or transformative conditions and surgery. The 12th to hospitalization, confinement, and hidden or psychosomatic factors. So house, medical emphasis, traditional. And this is the 12 houses and their traditional medical emphasis. Natural sign relationships, Aries equals the first, Taurus equals the second. You can further refine the reading. Also, house meanings in medical astrology follow the same logic as in natal astrology, with special weight on 1, 6, 8, and 12. See classical texts such as William Lilly's Christian Astrology for horary medical questions. As we see, the first, the ascendant, being the physical body, constitution, vitality, appearance, general health base sign. And the second house is your throat, neck area by derivative. Resources for care, self-worth linked to the body. Third house, lungs, arms, nervous communication, short journeys that affect health. Fourth house, chest, stomach, as well as it being the Cancer natural house. Hereditary patterns, home environment impact. We see the fifth house is heart, spine, creative, sexual vitality, recreation-related strain. Sixth house is the illness, acute conditions, diet, daily hygiene, employees, servants, small animals. Seventh house is partnerships affecting health, open enemies, lower back, kidneys, Libra's house, naturally. Eighth is chronic illness, surgery, transformation, shared resources for treatment and elimination. The ninth house is hips, thighs, liver, long distance travel, health, belief systems about healing. The 10th house is knees, bones, Capricorn natural, public reputation of health, career, stress. The 11th house, ankles, circulation, hopes for recovery, networks of support. And the 12th house is hospitalization, isolation, sleep disorders, hidden enemies, and self-undoing patterns. So Pisces is pretty karmic, and some people say, well, why are you saying karmic when you can change your life? Well, when I say karmic, I say the life hasn't been easy so far. Like, some people are born into generational wealth. Some people are born into poverty. And that's the reality. Now, whether that's luck, whether that's karma, whatever. But I believe in spirituality. I believe in the source, that there is a judgment day and some stuff went wrong in your past lives. Humors, temperaments, and elemental qualities. So we see ancient and medieval medicine rested on the 3 of the 4 humors. Blood, yellow bile, black bile, and phlegm, each linked to an element, pair of qualities. So that would be hot, cold, moist, dry, as well as a temperament, planetary affinities, and health was conceived as balance, disease as excess or deficiency of one humor. So we see sanguine is air, hot and moist, the humor is blood, Jupiter and Venus. Okay? Choleric, fire, hot, dry, humor, yellow bile, or sun. Melancholic, earth, cold and dry, humor is black bile, Saturn. And phlegmatic, water, cold and moist, humor, phlegm, moon, Venus. The 4 classical temperaments with elemental qualities, humors, and planetary affinities. So, in medical astrology, the natal chart was examined for the predominance of fire, earth, air, or water signs, and for the condition of the planets ruling those elements. A strongly choleric fire chart might be cautioned against excess heat and inflammation. A melancholic earth Saturn chart against chronic cold, dry, and restricted conditions. Remedies were chosen to counteract the excess, cooling herbs for heat, moistening for dryness, etc., often under the doctrine of signatures and planetary worship of plants, as in cool, peppers, herbal. The humoral system is codified in the Hippocratic corpus and systematized by Galen, remained the dominant medical paradigm in Europe and the Islamic world until the rise of modern physiology in the 17th and 19th centuries. So, practical examples and interpretive framework. Traditional interpretation proceeds by combining layers. The first is the sign of the ascendant and its ruler, and the planets in the 6th, 8th, and 12th houses. The condition of the moon and of the planet ruling the body part in question. Current transits or regressions to sensitive points. And in horary work, the chart casts for the moment of the question or the onset of illness, decomposure. So, example A is simple sign and planet combination. Mars and Aries in the 1st house. So Mars is hot, dry, and inflammatory. Aries rules the head, and the 1st house is the body itself. Traditional reading, predisposition to headaches, fevers, facial inflammation, or head injuries, especially under stressful Mars transits. And medication historically included cooling regimens, avoidance of excess heat and anger, and timing of procedures away from Mars-dominated periods. Example B is house emphasis. Saturn conjunct the cusp of the 6th house, ruling Capricorn on the 6th. Saturn brings chronicity and restriction. The 6th house is the house of illness. Capricorn rules knees, bones, and joints. So tendency toward long-standing structural or joint complaints, slow recovery, or conditions that require disciplined long-term management. Example C is lunar phase and decumbiture. In classical practice, a chart was cast for the moment the patient took to bed, decumbiture. And we see the moon sign, phase, and aspects indicated the course. Moon applying to benefics suggested recovery. Applying to malefics suggested complications. Critical days based on lunar phases will watch for crises or turning points, a doctrine already present in Hippocratic medicine. These examples are schematic. Real charts contain many interacting factors. Traditional astrologers weighed dignity, aspect patterns, and the overall temperament before offering counsel. Illustrated case studies. The following case studies are illustrated composites constructed from publicly discussed patterns in the medical astrology literature. They are educational devices, not records of real individuals, and must never be used as a substitute for medical diagnosis or care. So you see, the first case study is recurrent headaches and Aries emphasis. Chart signature here, Ascendant in Aries, Mars ruling the 1st house, square Saturn in Capricorn with Sun in Leo. So traditional reading would say Aries and its ruler Mars highlight the head and inflammatory potential. The square from Saturn introduces a restricted tension-producing quality, classic for tension type, or migraine patterns that worsen under stress and responsibility. Saturn. The Leo Sun adds a vitality component that may push the native to overexert. And the educational low Aries practitioners historically recommended cooling and calming measures, attention to anger, stress management, avoidance of elective head procedures. When the moon transited Aries, modern readers should note that headaches have many medical clauses requiring proper evaluation. We see in the second case study, digestive sensitivity and Virgo Mercury. So Virgo rising, which is of course with Mercury being the ruler, and it's in the 6th house in Gemini, opposed by Neptune, while Moon is in Cancer. So we see that Virgo rules the intestines and assimilation. Mercury in the 6th emphasizes the nervous digestive link in daily health routines. The Neptune opposition suggests sensitivity, possible boundary issues with food or environment, and a need for clarity in diagnosis. Cancer Moon reinforces stomach and emotional food connections. Traditional counsel often focus on diet regulation, reduction of worry, Mercury, and strengthening digestive fire without excess. Again, any persistent digestive complaint warrants medical assessment. And joint and structural themes, Saturn Capricorn. Capricorn on the 6th cusp. Saturn in the 6th in Aquarius, trine Jupiter, Mars in Capricorn in the 5th. So Capricorn and Saturn point to bones, joints, and chronic structural matters. Placement in the 6th house of illness reinforces the health focus. The Jupiter trine offers a protective or expansive factor, better prognosis, or access to supportive care. Mars in Capricorn can indicate disciplined physical effort that either strengthens or overtaxes the skeletal system, depending on management. Classical advice emphasizes long-term regimen, moderate exercise, and patience with slow healing conditions. Saturn rewards consistent, realistic effort. Case study 4 is respiratory theme, Gemini Mercury. We see Gemini Sun in Ascendant, Mercury conjunct Mars in the 3rd house, Uranus transiting the natal ascendant at the time of an acute episode. So Gemini rules lungs, arms, and the nervous system. Mercury and Mars conjunction can describe irritated or inflamed respiratory or nervous responses. Sudden Uranus transit to the ascendant historically correlates with unexpected events affecting the body. In literature, this pattern has been noted in discussions of acute respiratory incidents. Such correlations are anecdotal and retrospective. Acute respiratory symptoms always require prompt medical attention. Astrology is not a diagnostic substitute. And a horary style question. We see, what is the nature of this lower back pain? And a surgery indicated. Chart cast for the moment of the question. Examine the ascendant, the querent, 6th house and its ruler, illness. Any planets in Libra or the 7th, natural kidney lower back associations. If the moon applies to a benefic with reception, improvement without drastic intervention may be judged. If the 6th ruler is afflicted by Mars or Saturn without relief, a more serious or surgical path may be indicated in classical terms. Timing is read from the degrees of application. Horary medical astrology was widely practiced in the 17th century, for example by Richard Napier and William Lilly. Modern ethical practice insists that any such deliberation remains secondary to clinical diagnosis and informed consent. Composite cases are synthesized from patterns described in published medical astrology literature. In historical casebooks, no living person's private data is used. So, time considerations. Transits, progressions, decompositure. Traditional medical astrology pay close attention to timing. Transits of Mars, Saturn, Uranus, or Pluto to the ascendant, Sun, Moon, or sixth house ruler were watched for periods of heightened vulnerability. Secondary progressions and solar arcs provided longer-term windows. Lunar returns in the monthly lunar cycle inform short-term care. Decompositure charts cast for the onset of illness or the taking to bed were used to judge the nature and course of an acute condition. Electional astrology sought favorable moments for surgery or beginning a regimen, avoiding the moon in the sign willing the body part to be treated and preferring lunar applications to benefics. So these techniques reflect a worldview in which celestial cycles and terrestrial physiology were seen as coordinated whether or not one accepts the causal claim. The historical record shows that physicians and patients organized care around them for many centuries. Glossary of key terms. Decompositure. A horoscope cast for the moment a patient takes to bed with an illness used to judge the course of the disease. Dignity. The strength of a planet gains by sign placement, rulership, exaltation, or other factors affects its capacity to protect or harm. Horary astrology of the moment question is asked, extensively used historically for medical questions. Humor. One of the four bodily fluids, blood, yellow bile, black bile, phlegm, whose balance was thought to determine health. Iatromathematics. Classical name for medical astrology, physician adding mathematical astronomy. Malethesia, the mapping of zodiac signs onto parts of the human body. Zodiac man doctrine, malefic, benefic. Traditional classification of planets is harmful, so Mars, Saturn were helpful, Venus, Jupiter, and the Sun and Moon vary by condition. We see that reception is a relationship in which one planet is in a sign by another, allowing mutual support even in difficult aspects. And temperament, the overall humoral balance of an individual, sanguine, choleric, melancholic, phlegmatic, assessed from the natal chart. And here is selected footnote for the reading. So medical astrology or iatromathematics is documented from Hellenistic times onward. See the Wikipedia survey medical astrology and academic histories of pre-modern medicine. The zodiac man, Homo signorum, is ubiquitous in medieval medical manuscripts. Lunar prohibitions on surgery appear in surgical texts and almanacs. Malethesia shows strong cross-cultural consistency. Greek, Latin, Arabic, Sanskrit sources. Planetary origin rulerships are summarized in sources ranging from Ptolemy and Lilly to modern compilations, outer planet assignments, or 20th century developments. House-based medical readings follow standard natal and horary practice. Lilly's Christian astrology remains a primary English language reference. Humoral theory originates in the Hippocratic corpus and was systematized by Galen. It dominated Western and Islamic medicine for nearly 2 millennia. Case studies in this volume are educational composites, historical case books. For example, Richard Napier's and modern published series provide authentic examples for further study. Suggested further reading: Tetrapuplos, Christian astrology, herbal writings linking planets and plants, academic studies of medieval zodiac and imagery, casebooks project on early modern astrology physicians, and modern surveys of medical astrology as cultural history, not clinical guides. Okay, again, this compendium is intended solely as an educational and historical. This compendium is intended solely as an educational and historical overview of traditional medical astrology. It does not constitute medical, psychological, or therapeutic advice. No claim is made that planetary or zodiacal positions cause or diagnose disease. Readers experiencing health concerns should seek care from licensed medical professionals. The compiler assumes no liability for any use or misuse of the information herein. Peace and love. I'll see you in the next video. Bye, see you out.